The investment case for mental health in the Gambia represents both a sobering reality and an inspiring call to action. The evidence here underscores a true long recognized and often overlooked in public health priorities that mental health is not a peripheral issue but a central determinant of economic resilience, human development, and social cohesion. What stands out most from this report is the imbalance between direct and indirect cost. While government expenditure remains relatively modest, the disproportionate economic losses due to absenteeism and premature death amounting to over 100 times the direct costs demonstrate the profound systemic impact of untreated mental health conditions. The Permanent Secretary, Ministry of Health, Dr. Yusufa Toure, and the Chairperson of the National Assembly Select Committee on Health, Honorable Amadou Kamara, both revealed that by grounding the investment case in both economic evidence and local practical institution context, the report offers a blueprint that is at once rigorous and pragmatic.
The findings are both insightful and persuasive. The figures, which will be shown to you very soon, clearly demonstrate that mental health is not just a health issue. It is also an economic and development concern that requires urgent and continuous investment.
And I can assure you that from the point of the National Assembly, on behalf of the Speaker, and of course on behalf of the National Assembly Authority, we assert of our full support with regards to legislation, with regards to oversight, and of course with regards to resource allocation.
The WHO country representative in the Gambia, Dr. Nathan Bakaita, and the UN resident coordinator in the Gambia, Carl Frederick Paul, stated that mental health conditions not only cause individual suffering, but also have broad social and economic repercussions. These include an increased financial strain on health systems and a reduction in workforce productivity, as individuals with mental health conditions are more likely to leave the labor force due to premature death or disability, miss work days due to absenteeism, or work at reduced capacity due to presenteeism.
For far too long, mental health has remained invisible, spoken of in whispers, often misunderstood, and too often left behind when we are planning and financing our health services. Around the world, there's a growing recognition that there is no health without addressing mental health.
People living with mental health conditions continue to face systemic stigma, discrimination, and exclusion from society in clear violation of their rights to equality, to non-discrimination, and full participation in society as affirmed by all instruments, such as the Convention of the Right of Persons with Disabilities.
The Minister of Health, Dr. Ahmed Lamin Samate, said scaling up mental health services, embedding them within a whole-of-government approach, and ensuring that interventions are culturally grounded and context-sensitive will be a vital step forward. Adding that Gambia's leadership in commissioning the report sets an important precedent for other countries facing similar challenges. Dr. Samate further stated that this is the kind of evidence-driven, collaborative, and forward-thinking initiatives that can truly transform public health systems and, more importantly, lives.
This is not just a milestone, it is a turning point in our collective journey towards a healthier, more inclusive, and more compassionate Gambia. The government of the Gambia recognizes mental health as a public health priority. This commitment is reflected in the National Mental Health Policy 2025 to 2035, as well as the finalization of the draft Mental Health Bill, which aligns fully with our national development goals and the health sector strategic plan.
The Vice President, His Excellency Mohamed B.S. Jallow, revealed that the mental health investment case quantifies the cost of mental health conditions to the health sector and the national economy, highlighting the benefits in scaling up action. It includes a return on investment analysis that compares the current cost of mental health conditions in the country with projected health and economic returns from implementing a set of cost-effective interventions which both enhance treatment of mental health conditions and population-based preventive programs over 5, 10, and 20 years periods. VP Jallow further stated that the mental health investment case will also assess the current national mental health system identifying the most appropriate and feasible mechanisms for scaling up mental health promotion, prevention and care in the country, calling for the participation and contributions of non-health sectors to the country's mental health agenda.
We cannot build the Gambia we aspire to, a just, prosperous and peaceful nation, if our people are weighed down by distress, trauma or hopelessness. This is why mental health is not only a medical concern. It is a national development priority, a human rights issue, and a moral duty. Consequently, poor health leads to lost income, broken families, and lower productivity. It affects education, employment, and national cohesion. When a young person's potential is lost to untreated depression or substance misuse, the nation loses part of its future. When trauma goes unaddressed, it can echo across generations. This is why mental health must be embedded in all sectors, from education to justice, agriculture to finance. A teacher must understand the emotional needs of students. Police officers and judges must respond with empathy to those in crisis. Community and religious leaders must help end stigma and promote understanding. In this effort, every ministry has a role, every partner has a responsibility, and every Gambian has a stake.
Mental health conditions affect 12% of the Gambian population and account for 6% of the country's overall disease burden, measured in disability-adjusted life years. The new report presents the finding of the case to invest in the prevention and management of mental health conditions in the Gambia by scaling up cost-effective policies, strategies, and interventions. This investment case is expected to serve as a powerful advocacy tool, providing quantified evidence of long-term health, social and economic benefits of investing in mental health. Reporting for GRTS News, I am Omar P. Jallow.